Thank you, everybody. This is pretty cool. I mean, I remember when I did this, when Dan Fuelline and I did this before we actually merged, when we came and had a conversation, and we had probably, obviously quite less, but then last year, again, I think we were probably just past that second door there, and now at 460 some employees. This is extremely exciting. And before we get any further, I just want to thank you guys, each and every one of you, for the great work that you do. Nothing that we do, no help we provide, no hope we give our clients happens without each and every one of you. It doesn't matter what part of the organization you work in. It doesn't matter what your job is. The passion that you have to make a difference in people's lives is evident every single day. So you need to give yourselves a round of applause, please. So every morning I read a devotional, and this morning's was relatively significant because it says, all in the same boat. The quality most needed among teammates amidst the pressure of a difficult challenge is collaboration. Becoming a collaborative team player requires a change in 4 areas. Perception. See teammates as collaborators, not competitors. Completing one another is more important than competing with one another. Number 2, attitude. Be supportive, not suspicious of teammates. If you trust people, you will treat them better, and both you and they will be more likely to create a collaborative relationship. 3, focus. Concentrate on the team, not yourself. Author Cavert Roberts points out, true progress in any field is a relay race and not a single event. If you focus on the team and not just yourself, you'll be able to pass the baton when necessary. And 4, results. Create great victories through multiplication. Collaboration has a multiplying effect on everything you do because it releases and harnesses not only your skills, but those of everyone on the team. And I find it really interesting because one of the things that I've noticed as we've gone through these last 2.5 years is that when we work together, when we're able to do things as a group and as a team, our results are so much better. And then we're able to follow that up with something else and something else and something else. And the reason that we've had any amount of success is because of the work that people do together. Not because of the work of one individual person, but because of the work that we do together. And as you look at these 2 things that I have up here, this is behavioral health redesign. This is going to be our life for the next 12 to 18 months. And it is a challenge to what we're doing. But it's only a challenge if we don't work through these strategic plans that we put into play. Each and every one of you has an opportunity to contribute and do something great to make this agency better. And I am confident that we have the absolute best people in this room, and those people that can't be here because we also have clients that need cared for today, to make this happen. This vision, Hope Happens Here, really starts with each and every person in this room today. Because think about it, when somebody sits across from you, and those of you who have talked to me lately know how I feel, when somebody is sitting across from you, you are the most important person in their life at that moment. Because they believe that you have something that will help them solve the problem they came to. And when we don't answer our phones, when we walk in to meet people and we're distracted, they don't feel that full sense of hope that we want to provide them. And it's really interesting because this morning our alarm went off at our Cleveland Avenue office. And it went off because somebody needed help. And we weren't there today. And there are some days throughout the year where we're not there, and we have to find a way to solve that so that when people need help, we're there and they can find out how they can get help today. Because I know when I go back to the office and I look and it says, office is closed today, we probably didn't put a phone number that says this is where you can call and get help, despite the fact that we have a number of facilities that are open that could have helped today. So that's on me. I'm going to take that one because I should have saw that. But it takes all of us to recognize how we can continue to help people. Our mission to provide hope to all people through prevention, advocacy, support, education, treatment, and recovery is exactly what we do. And as much responsibility as this has for us, because we are the largest provider of behavioral health services, drug and alcohol, mental health services, and other services in the county, comes a great deal of responsibility. And you know, it's been pretty cool to watch that people have accepted that responsibility and have done some really, really cool things this year. So as we've created this organization called CommQuest, we've gone through some changes. We've gone through the integration process, the August of 2015 to June of 2016. And that was just getting to know each other. That was spending some time together, trying to figure out what we did well, what we didn't do well, how we could make it a better organization for the employees and for the community. In July of last year, we moved into a transition phase where we truly were moving our benefits together, our payroll system, moving everybody to 40 hours, looking at how we could integrate our offices, getting to know each other a little bit better. And we could have had a whole bunch of events that crammed people together to kind of push through that integration stuff. But you know what? The reason we didn't do that is because people did it on their own. People reached out to each other. People were nice. We practiced grace and kindness for each other. And we've learned about each other during that period of time. Not because we forced people into it, but because you guys made a concerted effort to be part of CommQuest services and to get away from being community services of Stark County and Quest Recovery and Prevention Services. And that's been really great to watch. You know, at one point I thought about putting little containers in people's offices and saying, okay, every time you said community services or Quest, you had to put $1 in there in the office that had the least amount of money in the jar won something. Then I thought, well, you know what, that'd be kind of cheesy because we're doing pretty well, and Bud Light already did it with their swear jar, and I didn't think that'd be such a good idea. So again, I think that we've gone through this transition really well because of the people that work for us. And now in January of this year, we entered into what we call the transformation stage. See, we were going to have a little bit more time to do this. But this lovely thing right here, that if you look at it in the computer is like in -2 font, really kind of pushes us along here. So Dr. Billow, who's sitting back there, actually started to create these great big wall-size posters for me by taking small sheets, blowing them up into size 15 or 16 font, and then taping them all together so I had a workable product. And then a number of people went together and put this and probably made PPI Graphics a little bit of money to get it on sheets like this. And hopefully it'll help. Because we're going through this transformation, guys, whether we like it or not. It's a transformation of our coding system. It's a transformation of our billing system. It's a transformation of our reimbursement system. I just spent a half hour on a phone call and then handed my phone off to Beth so she can continue the conversation that talks about how we're going to start managing through this from a fiscal part and from a program part. Because whether you know it or not, in order to change to this new coding system is going to require some changes on you guys' part, a lot of changes in the fiscal part. It's going to challenge our workforce, but most of all, it's going to make us better. Because I believe that everything that challenges us makes us better. Everything that's challenged this agency since August of 2015 has made us better. As we look back on 2016 and we kind of recap the goals that we have, we wanted to decrease wait time. We've done that. We wanted to implement a strategic plan to guide the organization from 2016 through 2021, and many of you were part of that process. We've done that. This over here will be posted in all of our outpatient offices, actually all of our offices, so that when you have contributions that you want to make that fit into one of these goal areas, you'll have an opportunity to take a sticky note or take a note card or something like that and either put it on here or make sure that somebody has that. Because the best ideas in this organization come from all of us, not just one individual, not just two individuals, not just folks that are in the senior leadership group, but come from each and every person in this room. And I want you to take this seriously. When we had our Christmas party, and the gentleman was talking, that was one of the things that I got out of it, is that we need to give people an opportunity to share in our strategic plan. And sometimes it comes by email, sometimes it comes by conversation. But if it's in your offices and you have an opportunity to look at it and say, you know what, today I have a good idea, or tomorrow I have a good idea, or whenever it comes up, you'll be able to share that. We expanded some programs, expansion of our core programs and services to meet the rising need for services within the community. And finally, we were able to integrate our administrative functions, merging billing practice, documentation, HR processes, and payroll. We're not done yet, by any means. We still have a lot of processes we still need to figure out. We still have some policies and procedures. We had a CARF survey the other day for some administrative stuff, and it went really well. They gave us some recommendations. But you know what? When I was talking to the gentleman that did the survey, he said, for as little time as you guys have been together, he said, I can see the benefits already. And I hope that you guys are able to see them also. When we talk about access to care, when we look at our assessment time in 2016, the average wait time was about 15 days. We're at 14 today. Assessments for drug and alcohol, we're at 14, we're at 11 days today. And if you look down here where Wilson Hall is, we used to have a considerable waiting period for that. But because of expansion, because of the support of our board and the support of a number of foundations, that's now at 0, where somebody can walk in today and get help. The challenge we have is still at Quest Deliverance House. And we're going to talk about that a little bit later, how we're going to resolve that. But you know, the other part that I'm most impressed with is that in August of 2015, the wait time for somebody to get in front of one of our prescribers was outside of 45 days. Probably close to 60 maybe. Where's Rebecca and Kira? Anybody remember what that time was? Above what? Never went above 53. So we are now at 28. That's remarkable for the field we're in. So our prescribers, our psychiatrists, our nurse practitioners, the nurses that work with them need to be commended for that, because we're making an impact because of the work that they're doing and the commitment that they've made. You know, we wanted to get people into RECOR sooner. Those folks who are struggling from opiate dependency. So we made a commitment when we opened that we'd do a nursing assessment and a doctor's appointment first before we do our diagnostic assessment. We've been able to take walk-ins. We've added some extra hours. Dr. Gibbs has been extremely helpful in making that happen. And now we're taking folks from 20 different counties in that program. We're making a difference, guys, in mental health and in drug and alcohol and in all of the other programs we have. When you look at our strategic plan, and you look at the goals that we have to enhance access to care for all clients in the community, to fully implement an integrated model of care, which means that all of our offices in Alliance and Massillon and Canton are integrated, along with finding a way to put primary medical care in there, because we know that about 85% of the clients that come to see us use stat care or the emergency room for their primary care. Why can't we be providing that for them? To retain, replicate, and expand our successful core services. So we have models that we work with, that we know work. We've created efficiencies. And as we look at opening new offices and expanding our services, that model that we have works. And we'll continue to use that as a replicative model. To become the employer of choice for our staff. See, I want people to come here and work because they see the good work you guys are doing and they want to be part of that, where we're a destination employer, not a place where people come and get trained and go off somewhere else. I worked at Edwin Shaw Hospital for a little while from 1999 to 2007. And Edwin Shaw's drug and alcohol program was not a destination employer. It was someplace where people came, got some experience, and then went somewhere else to work. What I see here is I see people that are committed to what we're doing, who come here to work, who stay here. And if you look at the number of people that have been here for a bunch of years, it's really awesome. Paul's been here 32 years. Joan Arnold's been with the organization 32 years. Okay. See, just because Glenn had a birthday prior to all of those lists, you know, he's really a relatively new employee. See, Glenn, it couldn't be a conversation, Glenn, without me picking on you a little bit. We want to reinforce our brand identity and our services. And I don't want to go places anymore where people say they don't know who we are. I was in Carrollton for CEO breakfast the other day, and staff says the community doesn't know who we are other than the courthouse. I don't want that to happen anymore. So we started putting stuff in the newspaper. And we've started to do some other marketing things so that people know who CommQuest is and what we do. See, I'm not a big fan of, you know, saturating a market with stuff. I don't know. I don't think that's being very humble sometimes. But we have to let people know directly what we do and why we do it. And most of all, that we do it better than anybody else. And lastly, create a sustainable operating and financial infrastructure. Those are not crazy goals. Those are pretty simple. We've completed some of them. We've created a CommQuest service directory. This coming Friday, we'll have the second of our Leadership Institute. We've hired an onboarding specialist. We've had our first onboarding of new employees. We've implemented the uniform badge protocol, standardized performance review process, strengthened our social media presence, and launched a new website. So our marketing and fund development department has done a really nice job increasing our social media presence. And if you haven't checked out the new website yet, please do. It's pretty awesome. Complete the hiring in the finance to support accounting level functions. We've hired a facility manager. Joe's probably going a little bit crazy, but Joe, could you stand up? Joe is our facilities manager. Please give Joe a round of applause. Joe has all kinds of gifts to fix things and make things happen, and I just can't even tell you how much I appreciate you being here, so thank you. Continue with our renovations committee, and then we've also implemented a purchasing committee because, frankly, guys, I have to tell you, some of our expenses were a little bit out of control. Okay, I'll give you two good examples. One, we spent $8.99 on a birthday card, which we could have bought at a dollar store for $1. Thank you. Not that we don't love our staff, but we could have spent a little bit less. So that's one of the things. And for some reason, somebody decided to buy a bottle of pop with the agency debit card that they no longer have access to. So again, those are things that people think, well, gee, it's only $1. But again, we have 460 employees. So think of it this way. If everybody did that one time a week, that's over $20,000 in missed expenses just on that one bottle of pop. So when we talk to people about controlling our expenses, and why can't I buy 10 cases of Staples paper? Well, because you don't need 10 cases of it. How Mike and the finance department works with our purchasing is going to have to change, guys, because of this right here, and because we have to be more efficient and effective in what we do. So we have some strategic plan action items in progress. Evaluate and acquire a new phone and data system. So this is pretty cool. So we will be able to actually take a phone call to one place, and instead of telling somebody, you have to call this number, we'll be able to transfer that call any place in the organization. Think of how incredibly easier that's going to be. The other part, and I want to talk about this because this is really important to me. You know, you guys have heard me talk about access to care, because I think that when people call us, if they call us and they expect us to provide them help, we ought to be able to say to them, would you like to come in today? But see, here's the process now that happens. They call, They say, I'd like to make an appointment for an assessment. We say, hold on 1 second. We transfer them somewhere oftentimes, and we have no idea what happens to them after that. We don't know if that call gets answered. We don't know if they hang up. We don't know if it goes into voicemail. We have no idea. So the solution to that is when people call and they want to make an appointment, the people that are answering the phones, which is going to be our new centralized intake department, will be able to schedule them right then and there. Think of what a difference that will make in our client's life. No more, hold on, let me transfer you. Okay? So for those of you who are looking at the job posting that says central intake staff, it is the most important part of our organization over the next few months in particular, because we need to get people the help when they want it. Not when it's convenient for us to call them back. Not, I'll call you back within 48 hours. So we're going to create about a 10-person central intake department where when people call, we'll make the appointments across the organization. I was talking to Alice the other day. I really think that the computer screen's probably going to be about the size of these two boards, just to get all of the staff in line. But again, we lose money because we don't match clients' insurance to providers. We'll have the same group of people doing that all the time. When there's a crisis and our intake folks are on the phone, rather than them having to go around and looking for somebody, there will be a counselor there in that group of people so that we can take those crisis calls right then and there, which again helps our clients. We have prior authorizations that occur that we don't always know about. We'll be able to take care of those at that moment when we need to as well. Guys, this will change how our folks get to services. And then if it's a call for another part of the organization, we'll be able to transfer that call to the right place. In fact, if Dan tells me right, we're actually even able to see if that person's on the phone that we're transferring that call to. Or we could put it on hold and say, you know what, let me check and see if somebody's there. And we can call and say, hey, I got a call for you, it's coming through here in a couple seconds. We are trying to minimize any challenges that we've created or barriers that we've created for our clients through this centralized intake department. Because again, when people call us, they want to see us. They don't want to talk to a voicemail. They don't want to sit around and wait for us to call them back. They want us to provide the hope that we say we're going to provide them. We're working on finding ways to integrate physical care into our business, to reinforce diversity and cultural competency in our hiring. And I want to thank Tiffany for the time that she spent this morning putting that together. You guys have no idea what a valuable resource Tiffany is. Could we give her a round of applause also? Because as you see in these times, we actually have kids in our schools who are worried about whether or not they're going to be able to stay in our community and in our country. And we have to have the ability to bring them comfort and to share with them that, look, you're here. We want to be sensitive to all of those things that in the past maybe we didn't have to be. But in today's climate, maybe we do. And it's an additional responsibility for us, but one that if we're providing that service in the schools, we need to do that. Identify best practices to duplicate and expand core services, improve our orientation process for new employees, evaluate the potential of an employee reimbursement program, develop online benefit enrollment process, better focus and align our key fundraising events, expand targeted advertising to increase public awareness of CommQuest, collect and promote client success stories. If you haven't been on the website lately, we have some client success stories on there. They've gone a long ways towards people understanding what might happen to them when they come to our organization. Fully implement the new billing system and continue to integrate finance and accounting systems So some of you, in addition to this here, know that we are moving to next-gen electronic health records. Rebecca has informed me I'm not allowed to be part of that, so that's good. So, Rebecca, do we have a timeline? July 17th. So, next-gen electronic health records, July 17th. So, just to kind of look back on some things that we did in 2016, you know, we took over the Stark County Jail program with little to no notice. It was basically a meeting with Sheriff Meyer, John Aller, John Oliver, Deputy Campbell that passed away, and Jonathan Stump, where they said, hey, guess what? We'd like to get rid of this. Here you go. Oh, sure, thanks. Now, mind you, a long time ago, that was a Quest program, and then the jail took it over. But when we took it over, Debbie, there were, what, 14 people in the program? About 14. How many we got today? About 26, and we've had as many as 30-something. 30-something. So we've taken a program that was adequate and made it great. Again, because of access to care. And you think, well, how can you change access to care in the jail? Well, you can change that by letting people come into the program instead of putting them on a waiting list. Because we know that people are waiting to go to jail, that are waiting to get into this program. If we can get them there faster, they have a better chance to succeed. We know that when people ask for help and reach out for help, if we can get it to them when they need it, they have a better chance to get better, whether it's mental health services or drug and alcohol services. So this allowed us to connect inmates with the agency's continuum of care also. We expanded our Minerva outpatient office, expanded that office to allow us to serve more clients. This is a collaborative project with Pathway Caring for Children. We've had that for a long time, but again, we're making a difference in a small community. The Wilson Hall third floor expansion, we added 16 treatment beds, an 8,000 square foot expansion for male residential so that we don't have any waiting lists. And then we extended hours at RECOR, the Regional Center for Opiate Recovery, to allow for walk-ins, and allows individuals to receive services on the same day. So this year, 2017, as I mentioned before, is a year of transformation. The intake stuff I talked about. Now let me just let you know that our focus on mental health and drug and alcohol services will continue to be the focus of this organization. 90% of our business comes in those areas. That doesn't diminish any of the work we do in emergency services, adoption, or any of the other programs we have. But sometimes we get all caught up in this whole opiate stuff, which is really important because it's killing our community. And don't think for a second that that's going to minimize the mental health stuff we do, because it won't. Behavioral health transformation will require us to change the way we do business. But because we have this full continuum of care on both the mental health side and the drug and alcohol side, and because we've done training in peer recovery support, and because we're going to know this better than anybody else does, we're going to come through this on the other side better than we are now. Yes, it is difficult. Yes, it will be challenging. And it's going to require a shift from being comfortable to being uncomfortable for a little while. But on the other side of this is great. Not just good, but great. We've built this organization to take advantage of all of these service codes. And I'm just going to let you know that we're going to need each and every person in this organization to be part of this change. Electronic health records go live, Rebecca talked about. And as I talk about access to care, I'm always going to talk about a sense of urgency, striving to get clients help today when they need it. We're looking for ways for staff to give ideas and suggestions. I spoke about that earlier with the strategic plan. We're looking for efficiencies, process improvements across all departments. So we're looking at each and every department. We want your input and evaluating programs. We'll be evaluating all programs from a community standpoint and a fiscal standpoint to make sure that those ones that we do, we can do better than anybody else. Some additional growth efforts in 2017, the Massillon outpatient integration, integrate our Massillon outpatient offices into one space to offer quicker, more coordinated access to care, and then take that space that currently is the Massillon outpatient and turn it into a women's residential treatment facility, creating a 16-bed women's residential treatment facility on that first floor. So I talked earlier about the wait list at Deliverance House. This will help us reduce this wait list. It's not going to eliminate it. There are more women in need of drug and alcohol treatment or behavioral health treatment than any other population in the state of Ohio right now. We'll do our part, but we can't solve all of the problems. I just read last night that SAMHSA has a grant out there that may help a little bit towards this. We haven't had a lot of success in doing that, but Christy and some others are going to work on that. We have the East Liverpool Medication Assisted Recovery Clinic, partnership with Family Recovery Center to provide methadone, Suboxone, Vivitrol, and then we've looked at doing the same thing in partnership with Town Hall 2 in Kent, where we would provide those medical services. In Alliance, we're working on integrating our offices over there as well, and then placing somebody in the federally qualified health center there. And then we're also in the process of a detox project somewhere in Stark County, Alliance, Canton, so we're working through the details of that in cooperation with our board, the Stark Mental Health Board, along with the state of Ohio. See, one of the things that's happened over this last few, since August of 15, is that we've integrated, we've done this transition, and we're in this transformation. And the culture that we've seen in our organization has changed along the way. And as I'm always looking for us to get better, and I'm always reading in that, I came across a book called The Ideal Team Player. And in that, it talked about being humble and hungry and smart. Humble meaning that we take credit as a team for what happens. That we don't stand up and say, look at me, look at me, look at me. But we practice grace, we practice kindness. We care about each other. We work together as a team to have great solutions. To be smart. Not necessarily IQ smart, but to understand when you say something, the impact it has on the rest of the group. When you send an email, understanding how it might be received on the other side. When you tell somebody you're going to do something, you do what you say you're going to do. And hungry, which means that you have a passion to do what you do each and every day. That when you get up each day and you come to work at CommQuest Services, you do that because you know that that person that's sitting across from you really truly believes that you can provide them with the hope that they need. People have these three qualities in a varying degree of significant part in their life and in their person. We want people working with us that are humble and hungry and smart. And I truly believe that the 460 plus people have these qualities. And we can help work to develop some of these even better so that we go from good to great. So that when people pick up the phone and call us, the reason we answer that phone is because we recognize that we have something they want. We can provide them with the hope that they need. And if we don't do that, if we don't care about this, let me know. Because we'll gladly help you with your resume. Because these things are really important to our clients. And they're the reason all of us started in this field. In the book that I read that talked about this, their goal was to get rid of all of the jackasses in their company. I truly believe that in our organization, this culture takes us from good to great. That when we work together and we develop these characteristics, individually and as a group, every single person in this room is going to be part of that. Because I trust that you guys are all here for the same reason, and that is to help our clients get from whatever situation they're in today to something better. Our board of directors that you see here and you heard from Shannon, thank you, are a tremendous support to our organization. You know, God gives everybody gifts. And our responsibility is to find out what those gifts are that God gave us and reach our potential. And I just want to tell you guys, I am so pleased to lead this organization because of each and every one of you. Thank you.